one of the issues that will go in here, but we'll appoint a special committee because that's an emerging issue, is the issue of Resolution Health. What can be done about it so that the pain is not painful, it's not too painful. We find a solution to turn around that situation. Yeah, so you can see the NHIF members are facing the lack of neutral English. So jury and, NHIF is the jury and the judge. So basically we told MOH, and we're going to follow up with a written document that says that, and the good thing is that when you speak to other quarters like Parliament or no, they say that's something they're also keen on. You cannot be collecting the money, you cannot be the one deciding who to pay and onboarding who to pay and when to pay and so on and so forth. There has to be separation of duties. That's very critical for us. We're saying appoint an independent organization that will be also, if they're aggrieved on either side, you can run to. And then delayed payments owed to private health facilities. Please, I think we've only received 2 so far. NHIF told us the historical payments of 17, 18, they're working on them to resolve that because there were technology issues. So we know that a lot of your money is tied in there. Unfortunately, they said they ended up paying some facility twice. We don't know. But what they told us is that we're going to give you a template for your members to fill, and you submit. And they submit one by one. So we have received 2 so far. Please, if you're owed money by NHIF, even if it's the one which is locked up, fill those 2 templates. One is for outpatient, one is for inpatient. Send it to us. When we send it to NHIF, we will have you on copy. So please do that as soon as, if you can, by tomorrow, but we'll leave it open. It's just a matter of the urgency on your side. That's very important. Then we have delay in issuing new contracts and delayed onboarding of accreditation of services to existing health facilities and NHIF contracts. I think those discussions are ongoing. And we hope by start of July, things will be moving. The agreement is that for new services, they will be onboarded as they happen. They're not going to wait for the renewal of the contract. Payments, currently they promise that they're paying within the agreed contractual terms at worst, yeah? Apart from those special cases. So if there's any deviation to that, please let us know so that we can also have a dialogue with them and see how they can help you. But also on our side, we make sure that our documentation is very, very complete, so to speak. Reimbursement rates for specialized care, that's an ongoing discussion. It's also the discussion they're having in NHIF boardroom now. So the chair, our care chief chair is spearheading that discussion. And I think we are fully engaged and we are fully alert. I think that's what I can say. The outcome, we'll see what comes at the end of it. Then operationalization of NHIF Amendment Act. These are the draft regulations, which, as I said earlier, we have submitted our memoranda on each of them. And also, it's what they're discussing at KICC today. It's what we discussed. It's also been part of the discussions with NHIF in the boardroom, I think, today, last week as well. And tomorrow also there's a meeting on the benefits package. Sometimes they limit how many people can attend. So when we send a call out, please respond as soon as possible. Sometimes we might not do a call out because Dr. Obita, Joki, and the lead in the healthcare financing, even within the healthcare financing committee, we already have representatives. Yeah. So don't worry when you feel you're not engaged.